Hi folks, Craig here. I use he, him pronouns. I'm joining you from Wurundjeri country today. Thanks for tuning in to the CEO update. I wanted to give you an update on the reforms coming out of the Royal Commission and some of our meetings with the Department of Health. The really big one and great progress, we met with the department, and also Shark were there as well, the Self-Help and Addiction Resource Centre, to talk about Recommendation 29, our agency. So as you would know, that's the what we've been calling also the consumer agency, to support and develop consumer initiatives across the state, and to link in with other parts of the reform as well. So Tuesday and Wednesday last week, we had in the morning half-day workshops looking at ways of working together, and the tasks that we needed to do, and the work plan ahead. And of course, for us, making sure that the work is done in a way that VMIAC has a strong voice. So that was really, really good progress. And it was certainly nice to be able to have that luxury of stopping and thinking a bit more in a bit more of a reflective way as well. Also to do with the reform, maybe one other sort of highlight has been the work going on around access and triage. We know from talking to many of you that accessing services can be hard, and people can lose their connection with services in the very initial stages to try and connect. So we've been doing some strong advocacy around access and triage to make sure that people's strengths are honoured when they're accessing services, and making sure that people don't have to say information twice, and also but making sure that things don't go out of control for people, so that suddenly, three other people know your information and you didn't know that was going to happen. So that's the type of work that we're doing there around access and triage. And as I said, we know how important that is for people. I wanted to give you an update around the National Mental Health Consumer Alliance. So that's the alliance of all of the peaks, from the consumer peaks from all of the jurisdictions across Australia, except Northern Territory, who don't currently have a recognised peak. And particularly around that is that our research and policy lead, Gabrielle Alexanders, went to Canberra recently, in my place because I was unable to go. And Gabrielle met with, along with the other leaders of the state peaks, met with Assistant Minister Emma McRae to talk about the process for establishing the national peak. So that was an opportunity for all of the Alliance to forge relationships with key project staff in Emma McBride's department. So stay tuned for more news on the establishment of the national peak. And just to note here, of course, that a great deal of amazing work has been done prior to this moment by others in the consumer space to make sure that this happens. And we're drawing on some of that expertise as we go forward with this. I wanted to give you an update around VMIAC's workforce. Our recruitment for a lived and living experience workforce manager continues. So hopefully be able to give you some news about that shortly. A comms lead role will be advertised shortly. So that will be on ethical jobs, where we put all our jobs. And also on ethical jobs at the moment, there's a digital comms officer role. It's currently advertised and closes on the Friday the 14th of April. So if that's your thing, please check it out. The other one too, just to give you advance notice, is there will be a part-time position. It looks like that will be 1 day per week through until November, to help us deliver on the VMIAC conference. So confirming now that we're holding the VMIAC conference in November, and that there's a part-time role be advertised shortly for someone. Maybe someone who's got a few other commitments and things, who might be able to fit in that 1 day a week to work for us for the conference. To update you on some partner conversations. First of all, the Healing Place, that work is now with Mind. Some of you might know that as the LERS, L-E-R-S, the Lived Experience Residential Service. And that's, of course, a hugely important one to us here at VMIAC and for consumers, because it's a service by consumers for consumers. And of course, we're hoping that it's an outrageous success and that it will be replicated across the state so that care can be delivered for people in a way that is consistent with, for example, if you see VMIAC's website, the VMIAC Declaration, what people are asking for in their care about being nurtured, healing, and those sorts of things. So I'll keep you updated as I can around that important work. I also was lucky enough to be part of a trialogue, so 3 of us talking, and that was myself, Andrew Tomlinson, the Deputy CEO of Tandem, and also from the clinical sector, Dr. Asta Tomar, who's the chair of the Victorian branch of the Royal and Australian New Zealand College of Psychiatry. So this was in a leadership forum hosted by CMHL, and it was the audience was like across the sector, people interested in leadership as well. I think it was a really good way to model the 3 of us talking together, rather than say Andrew and myself talking as lived experience separately, and then Asta having her own spot. So we were kind of modeling working together and being in constructive dialogue together as well. So yeah, some of you might have caught that if you went along to that forum. I just want to update you also about our committee of management. There has been a transition in the chair from James Horton to Tricia Zrong. So James has got a lot of other commitments going on, and he didn't think he would be able to give being chair the attention that it needed to be given. So he has stepped down from the chair. He remains a member of VMIAC, of course, and we are certainly hoping that he'll be back in governance at the organisation at another time. He's done an amazing job of supporting me, like on a personal note, and also leading the governance of VMIAC. So we wish him well and hope to see him around really soon, so we can continue to benefit from his wisdom, expertise. So Tricia, some of you may know, has previously been the deputy chair and the chair of the committee of management, and also during the pandemic for 18 months was the CEO of VMIAC as well. VMIAC's is very lucky to have Tricia with the breadth and depth of the experience that she has, including running her own consultancy, serving on multiple boards, and of course that previous experience of VMIAC. So it's great to have her on board, and we're very lucky that she's able to step in, most likely through until the AGM, which will be around November this year. I also wanted to talk about our advocacy with Victorian Aboriginal leadership organisations, and I wanted to talk about 2 things here, Pockham's Law and also Police Ombudsman. So VMIAC stands with VALS, Victorian Aboriginal Legal Service, and the family of Veronica Nelson as one of 56 organisations endorsing the fight for Pockham's Law. As a young girl, Veronica called possums Pockham's, hence the name of this much-needed law. So Veronica's a Gunda Chamara Jajawarang Wiradjuri and Yorta Yorta woman, and she died in prison. Victoria's discriminatory bail laws put her there for shoplifting-related charges. The coronial inquest into Veronica's passing found that the bail laws were complete and unmitigated disaster. Victorian government has since committed to bail reform. So we stand with VALS on the call for the Victorian government to urgently implement Pockham's Law. So also standing with Indigenous organisations, we're a signatory to the Police Accountability Project. So this is about there being a police ombudsman, so that police don't investigate themselves. Police have great powers, as many of you know, and many of you, I think, have experienced as part of your lived experience. And we are looking for a way that police can be investigated by an external body. And so we stand with VALS on the call for a police ombudsman as well. And also watch this space for more work that VMIAC is doing with Pacho as well. So some sad news. We learned last week that Anthony Stratford passed away. Anthony was a trailblazer in lived experience work, consumer lived experience work, both nationally and also internationally. He played a huge role at Mind, the organisation Mind, including the development of peer work training. I was lucky enough to go to that training with Anthony quite a few years ago, with co-facilitator Robin Callahan. And Anthony created a space for us to feel like we had a foundation and a framework for doing peer work. So very valuable work. So lots of people have been touched by the work that Anthony has done. He passed away after a battle with illness. The funeral will be Friday the 14th of April in Bendigo in the morning. So if any of you need the exact details of that because you want to attend, then please let us know and we can pass that on. So if you contact us at reception@vmiac.org.au or our phone number 9380 3900, we can give you those details. And my condolences, of course, go to those close to Anthony.